So, good afternoon, everyone. I am Dr. Rajarshi Banerjee. I'm a practicing physician in Kolkata. So, today we will discuss about high blood pressure. The medical terminology is hypertension. So, what is hypertension? What are the signs and symptoms of hypertension? What are the risk factors of hypertension? And how to prevent it? So, basically, hypertension means when our heart pumps the blood through the different arteries of our body, arteries or blood channels in our body. At that time, it generates some pressure. So basically, hypertension means that pressure, the against which our heart pumps our blood. So during the pumping of the blood, the pressure, which is the upper one, is called systolic blood pressure, and the lower one is called diastolic blood pressure. So generally, when a patient comes to us with blood pressure like 120/80, then the upper one, that is 120, we mean the systolic one, that is the pressure which is generated during the pumping of the blood through the artery, and the lower one is occurred during the relaxation of our heart, which is known as diastolic blood pressure. So, what may be the sign and symptoms of high blood pressure? Patient may come with different symptoms like headache, blurring of vision, some dizziness, vertigo, buzzing in the ear, or unexplained lethargy, weakness, etc. But sometimes there may be no symptoms of hypertension, and it happen in most of the cases. And incidentally, somebody came to my chamber for fever or some other problem, or with sugar or high cholesterol. That time, incidentally, we found that his or her blood pressure is on the higher side. That is why hypertension is also called a silent killer. It will be in your body, but there may not be any symptoms of that. That is why you are not aware of the situation. You will not go to a doctor for treatment. So it is a silent killer also. So what may be the risk factor of developing high blood pressure or hypertension? The first one is family history or genetics. If some of your relative, first degree relative, that is with whom you have blood relation like father, mother, your brother, sister, or relative have high blood pressure, then you have excess risk of developing high blood pressure in your lifetime. The second thing is that age. With age, our arteries or blood channels get thickened. That is why with age, mostly after 50 years or 60 years, the risk of developing high blood pressure is high. Third one is stress. If you are on under continuous stress, in that case also, in long run, you may develop high blood pressure. The fourth one is addiction. If you smoke cigarette or if you have the addiction of consumption of alcohol, in that case also, the risk of developing high blood pressure is high. And last but not the least is diet. So you have to be very careful about your diet also. If you are consuming junk food, fast food, processed food, regular basis in high quantity, or you are taking some salted food or extra salt with your meal, in that cases also the risk of developing high blood pressure will be high. Now, if you are going to a chamber of a doctor and doctor found that your blood pressure is high, but when you are going to your home and you are taking again your blood pressure, that time probably your blood pressure may be normal. So this type of situation may appear, and in our regular practice we deal with such type of situation. So this thing, when you are visiting a hospital or a healthcare setup and your blood pressure is high, so this is called actually white coat hypertension. So white coat means generally we wear a white coat or apron during our chamber hours in hospital, and that time by seeing a doctor, a nurse, or due to the environment of the hospital, your blood pressure may be on the higher side. That is why on our day-to-day practice nowadays we also encourage our patient to take their blood pressure at home, in home condition, by some digital machine nowadays available very easily, and that is called home blood pressure monitoring. So that is why before giving up blood pressure medicine to our patient, generally we ask our patient to take their home blood pressure also for maybe say for next 1 or 2 weeks, and come to us again with that reading, so that we can judge whether the patient is suffering from white coat hypertension or true hypertension. Then there is another misconception that if you start your hypertension medicine, BP medicine, you need to continue it for your lifetime. This is why actually if you are suffering from high blood pressure, then your heart have to pump the blood against that pressure each minute 60, 70 or more than that. But with by doing this, what happened due to this exercise of the heart will get bigger and bigger with time, and ultimately it culminates into heart failure. That is why if you are suffering from high blood pressure, you need to start medicine very early, and you need to continue the medicine regular basis, and you need a regular checkup for your high blood pressure. And we came to the last part of this discussion. And if you have high blood pressure, then how to tackle it? To tackle the high blood pressure, you need to do something like you need to do some regular physical activity like brisk walking, maybe 30 minutes per day or 150 minutes per week. You can do some aerobic exercises on regular basis. You can cut short the amount of salt in your diet, mainly the sodium. You need to increase the consumption of potassium, that is, you can have fruits on regular basis, fruit, vegetables, all these things. You should avoid junk food, fast food, processed food as much as possible. You should monitor your blood pressure on regular basis, and if your blood pressure is high and some physician or doctor give you some BP medicine, you need to take the medicine regular basis. You should not miss your pressure medicine, and you have to check your blood pressure regular basis, and a regular follow-up with the doctor is very much essential to tackle the problem of hypertension and its complication. So that's all for this session. Thanks for the patient hearing.